Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor, and this is a video about thyroid glands and mitochondria. And the question mark of, are the symptoms that a patient's experiencing related to thyroid dysfunction, or is it mitochondrial dysfunction? And in some cases, it's both. And in some cases, it seems that the supporting perhaps just one system versus the other might not yield the optimal results for a given patient. When it comes to the symptoms of hypothyroidism or a suboptimally functioning thyroid gland, and this would include, say, both full-blown hypothyroidism and of course different autoimmune conditions like, say, Hashimoto's would be a fairly common one that would be characterized by an underfunctioning thyroid gland, or it could be something like sublaboratory hypothyroidism, sometimes known as Wilson's temperature syndrome, which would be where there's all these symptoms of low thyroid function, but all the labs look totally normal. Some of the outside of the box labs, like reverse T3, for example, are looking at different ratios of T3 to T4, and some of these functional laboratory ranges are off kilter, and then the patient winds up feeling better when they go on thyroid hormone replacement therapy. So that would be another that would fit into this umbrella, basically, where there seems to be a thyroid issue going on. So when there is a low thyroid issue going on, the common symptoms that would come up from that would be fatigue, issues with difficulty losing weight, so like an elevated body weight, feeling cold, sometimes feeling constipated, sometimes having dry skin, and there's other symptoms that could come up as well, but those would be some of the more common ones. Sometimes lower mood, sometimes sleep issues. There could be a lot of different symptoms that might affect a person with a low functioning thyroid. So that's the list, kind of the typical list, the classic list of the most common symptoms associated with low thyroid function. Now, if you look at the common symptoms associated with a person dealing with mitochondrial dysfunction, well, fatigue is on that list as well. They might have issues with their ability to gain weight. They might have a lower body temperature. They might have constipation. They might have issues with dry skin. They might have a lower mood. And there's other symptoms they might have too, like brain fog, although you can have that with hypothyroidism too. So you can see that there's a lot of overlap with those two lists. They're in some respects kind of the same list. I would argue that mitochondrial dysfunction can extend beyond that list and sometimes translate into like incredibly debilitating fatigue and pain issues and tight muscle issues and things like that. But those classic lists are pretty much the same list. And so the question mark would be, well, is it a thyroid issue or is it a mitochondrial dysfunction issue? And when you look at the physiology of how thyroid hormones and mitochondria interact, then you can see, well, it's really not like an either-or kind of conversation, because their functions, their physiology is intrinsically linked. So the reason I say that is because the hypothalamus produces thyroid TRH, so thyrotropin releasing hormone, that then binds to receptors in the pituitary gland to release TSH, which is thyroid stimulating hormone. That TSH binds to the thyroid gland itself, and then the thyroid gland produces T4 or thyroxine, and then that T4 largely in the liver, and I believe it's the kidneys, and maybe my physiology is a little bit rusty around that, but in those tissues and others, it happens in other tissues too, the T4 gets converted into T3, which is that active form of thyroid hormone. And so then that T3 then goes to bind to receptors in the nucleus of the cell, and then that cell, so it binds to the receptors on the nucleus of the cell, and then, or in the nucleus of the cell, on the DNA. That ultimately causes more gene expression, and those genes that are expressed tell the mitochondria to make more energy. So, making a very long story short, when the body needs more energy, then the thyroid hormone is going to be produced. It tells the cells to tell the mitochondria to make more energy. So the take-home message would be, you can't have proper thyroid function in the grand scheme of things, or the effects of the thyroid hormone cannot be achieved without the mitochondria. So thyroid hormones being supported at the wazoo with either desiccated thyroid or sustained release T3, or maybe just good old synthroid, whatever it is. But if the mitochondria aren't functioning optimally, you're not going to get that energy production that you're looking for, or at least not optimally. And so in my experience, in my practice, I've had hundreds of patients over the years that come in, they've been diagnosed with probably over a couple thousand patients over the years that have been diagnosed with hypothyroidism. They're on either, oftentimes Synthroid, sometimes desiccated thyroid, things like that. They come in and they'll say, I'm on on the treatment, my lab numbers look normal now, and oftentimes they'll say, like, I feel better on this therapy, and sometimes they say, I feel like $1 million, and like, I'm not here for fatigue or body, like metabolism issues or whatnot, because I'm feeling so good on my thyroid treatment. But in my practice, at least, that's pretty rare. And granted, if someone was already feeling great on their Synthroid, they probably wouldn't come to see me in the first place. So I am certainly seeing a skewed biased population, but many of my patients, the vast majority, when they come in and they're still struggling with fatigue, I'll say, well, like, how are your thyroid numbers? Like, they look fine now. The thyroid treatment has, got my numbers looking good, yet my energy's still not where I want it to be. My body temperature's still low. My skin is still dry. My bowels are still sluggish, whatever the constellation of symptoms is. And so then what that speaks to me is that, well, you're supporting your thyroid, which is great, but what does your thyroid hormone do? It basically, from an energy and metabolism perspective, tells your cells to tell the mitochondria to make more energy. So if that optimal thyroid hormone level is not resulting in ideal energy, ideal mental clarity, ideal metabolism, the question mark is, well, what's happening downstream to that that's probably getting in the way of seeing those wonderful results of thyroid hormone? So the take-home message would be, if a person was not feeling optimal, even though their thyroid labs look all normal with treatment, it would be worthwhile to talk to your clinician about seeing how those mitochondria are doing, and maybe that's what needs to be supported. And in clinical practice, in my experience at least, supporting the mitochondria comprehensively can really get those symptoms resolved and on track.